Take a moment to look at this waveform. What jumps out first is that the baseline, the flat portion between breaths, never truly returns to zero. Instead, it hovers above the line and gradually creeps upward over time. That is the classic fingerprint of CO2 rebreathing. The patient is inhaling air that already contains carbon dioxide, so with every breath, the CO2 concentration starts a little higher than the one before it. Why does this happen? It usually isn't the lungs themselves at fault, it's the airway system. Something is preventing the exhaled CO2 from fully clearing the circuit. Maybe the mask is partially obstructed and trapping expired gas. Maybe the patient is breath stacking on a ventilator, unable to finish exhalation before the next breath arrives. On a mechanical ventilator, this might mean inadequate expiratory time or a peak PEEP issue that needs immediate attention. In a bag mask situation, it might be as simple as an over-tight seal or a valve that's not functioning correctly. Clinically, this pattern tells you the patient is re-inhaling CO2, which will push their arterial CO2 higher and begin tipping them toward respiratory acidosis if it's not corrected quickly. Your mind should immediately go to airway mechanics. Is the mask leaking or obstructed? Is the valve moving freely? Does the ventilator circuit need to be checked? Is the CO2 absorber full if you're using an anesthesia-type device? Fix the mechanical problem, restore fresh gas flow, and the baseline will drop right back to zero. When you see this waveform, don't chase a metabolic problem first. This is almost always a straightforward airway equipment issue, not a patient physiology crisis. Thanks for watching. If you found this helpful, go ahead and like the video and subscribe to the channel so you don't miss the next one. And if you want the full masterclass, along with tons of other high-yield medical education, visit academy.emergeprep.org. And I'll see you in the next lesson.